My name is Ritesh Patel. I'm a certified diabetes educator, board certified in advanced diabetes management. I also have a designation in North Carolina called CPP, which is Clinical Pharmacy Practitioner. I'm proud to be a CDE and a BC-ADM, just newly a BC-ADM, and I have some colleagues of mine that are pharmacists as well that had some questions about BC-ADM, so we'll speak to them today. I'll go with Blake. Please introduce yourself and let us know what you do now.
All right. My name is Blake Sullivan. I am a clinical pharmacist in North Carolina. I just graduated about 2 or 3 months ago, so I am an aspiring BC-ADM. I did have a few questions about the process, what all goes into becoming a BC-ADM. So I guess I'll start, why is it important to have that BC-ADM behind our name?
So, as a pharmacist, it's always been a struggle. Some states have the provider status, some states don't have the provider status, and we are healthcare providers. It's been a struggle to sort of have that designation, but more so, we already do the diabetes management, and I think to have the designation was important because when we go ask for referrals, about 5 years ago when I went to go ask for referrals from physicians, it was difficult because I didn't have a designation. I saw patients, I had a very small database that I had created with our patient care models that we had in our pharmacy, but we did not have the designation. But now when I walk in with BC-ADM and CDE and CPP, it's a little easier and comfortable for the provider to say, I trust my patient to go with you, and you can help me manage this patient together. So I think that designation really helps us make sure that we're in the right path, and now colleagues and providers together, we can really help our patients. And it creates a structure in our program. So now we have standard of care and our scope of practice as pharmacists to make sure that we're treating our patients similarly but individually. And I think that helped. That was a lot of help that we got from AAD as well to be able to really help have the curriculum for both our education program and the BC-ADM program now. And I'll ask you, Cornelius, to please also introduce yourself and let us know what you're doing now.
Okay. I'm Cornelius Toliver. I'm a clinical pharmacist also from Raleigh, North Carolina. My goal and dream is actually to work in diabetes. It's always been that way. And I understand that you're a CDE and a BC-ADM. Having the CDE before, what made you want to go after the BC-ADM?
That's a great question because we do have so many diabetes educators right now, and actually, obviously board certified diabetes educators, but we do not have that many BC-ADMs. We only have around 1,000 BC-ADMs in the country, only 36 in North Carolina, and so it was important to me to sort of, after getting my CDE certificate in 2014, to see how we can explore helping our patients more. What we ran into in our practice is that we were managing our patients and doing the education at the same time. And so, after Medicare reimbursement, time would run out. Obviously, we still, if the patient needs the help, we're still going to help the patient. And so by doing the BC-ADM now and having that designation, what helps me now is to separate two departments. Under the education department, we have our director of education and our dietitians and our educators to help our patients self-manage diabetes better. And on our advanced diabetes management department, what we have now is direct visits under a physician's supervision and helping patients really manage their medications and their therapies and reporting back to our providers to say, well, this patient couldn't tolerate a medication, so we had to change this dose. Do you agree? So now we can spend even more time with our patients. And what we've seen in our practice is, and I don't know if I can quote this, but we definitely have greater than 50% patients at goal A1C within 3 to 6 months after they see us, which is pretty neat to say because now we're having the education, the management, and all the providers and ancillary services working together to help that one life. And as you know, in Raleigh and in Benson now, our practice is really trailblazing because we have now partnered clinically as pharmacists with collaborative practice agreements with multiple clinics in the area that trust their patient care to a pharmacist, not just to dispense medications now, but to really make sure that we're helping them change their lifestyle, making sure that if we need to modify their medications because of cost or intolerance, that we are able to do that for our patients now. And then obviously have the education piece, and then involving everybody in the care team, right? So your providers, your nurses, your dietitians, pharmacist, and the patient, which is a key part of this all, because without the patient we can't really help anybody at this point. So I know this is an elongated answer, but really I thought it was important for me to say, well, great, we're educators, but I need to also be a certified manager as well. And then on the other side, reimbursement. Now when we go to an insurance company and say, listen, this is our data, but our clinical pharmacists are certified to be able to help the patient, we're always going to be a step ahead from the other professionals that are also colleagues, definitely, but they're not certified. We should be able to get those contracts hopefully through insurance, knowing that we've gone through extra training and an extra certificate process.